to meet you.
Love to meet you with respect.
Good to meet you. Good to be here.
Good, thanks for coming.
Doctors, can you do a high five with the doctor?
Yeah, you can't do. You
Don't you
can't
get afraid?
do.
Don't you get afraid your hand might if I over?
These guys probably work with 4 sanitizers in their pocket. Yeah, wow. Every time they're just cleaning.
It's so cool. Anything can
Even
do.
this one.
Yeah, we can do
The
that.
days of COVID-19.
So fine.
Ebola even.
Even
So
Ebola.
fine.
Okay, thanks for coming.
Yeah.
Good, yeah. Good to be
So
here.
he's based with the Case Hospital.
Good to be here.
And since we're in the month,
Case Hospital, it became a hospital.
Yes, a
It's no
hospital.
longer called Case Clinic.
Before it was Case Clinic,
Yeah.
from the inception 1999 up to around 2017, when it became now into
a full-fledged hospital,
Yeah,
eh?
hospital,
In
yeah,
2017.
offering wide services, anything you think of medical sector, we can.
You can now.
Yeah, offer that. Yeah.
basically, Case Clinic grew up. It got a beard.
A beard?
Yes, yeah.
Stop wearing diapers?
Stopped wearing knickers,
Yeah.
pampers.
That's a
Put an
underwear
thongs,
and
Yeah.
full pants.
and parties.
Yes.
Then the boys grew deeper.
Yeah.
Became an adult.
Became a grown man.
It even now
grown
has
woman.
grandchildren.
With
like,
grandchildren.
Ah, very good.
Case Nadia, Case Chira, Case Kasese. and
But those small ones now, those
Yeah,
ones are
yes.
still clinics.
Those are still-
Yes, yeah.
okay.
So basically,
But
Case
those-
Hospital was. It was busy on these ones.
Whatever that is, it's so good, yeah. It's so good.
So foolish.
So good, yeah. So good.
So, Guy had mentioned that you were coming, and in the special, June is Mental Health Month
Yes.
For men.
For men.
for men.
For men, yeah.
Ah.
For men, yeah.
So, and it's good you have come because
Now men's time, men's month, yeah.
Guy and I discussed here a while back.
Yes.
There was a time when we went through a 10-day, maybe 2-week period of unexplained suicides. Actually, 2 of them were alleged suicides, but nobody gave us a full story about 2 guys who were found hanging. The other 2 guys who jumped off, we knew it was suicide because one jumped off a building, the other jumped off an apartment block, the other jumped off a hotel. But 2 guys were found hanging, and apparently this seems to be like we're genuinely concerned. And it's always men.
That's right, yeah.
It's becoming a real
yeah,
issue.
we call it a public health concern, yeah.
Yes.
Now it is, yeah. It is, yeah.
Now,
yeah.
I was discussing with the guy earlier. I said, I don't know whether it's because of women giving them too much stress,
Or is it because of lack of money?
or is it because
Money is a
of
problem?
economic situation? I can't live the life I want.
Is it a combination of both?
Is it social media?
Yes.
Or a mix of some
Or a mix of all of them? Is it too many expectations from family?
Is it the economies?
So,
Okay.
over to you.
Thank you so much, Marcus and Guy. That's so good and right observation. It's true we have had those cases. I think on the rise. That's from the media reports. Yeah. And to define partly what men's health is,
Yes.
it doesn't really mean you not having a disease, but your complete well-being of your physical, social, and the mental.
How about economic
The economic, yes, it's part of it, and the social part of it.
and the social?
Now, coming out to the side cases, the causes can be several and can be shared along, and of which the drive of that comes from your mental aspect in what you're dealing with at heart, in mind, in your community, at home, at work, your neighbors, your community.
Your mental
Yes.
state of being
Exactly.
is very important.
Very, 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 very key. Very, very big. It defines how come you're right now, okay? Your well feeling, how things are at home determines you, how your bosses are treating you.
So
Yes,
this has, let me ask doctor.
Yes, please.
This has always been there, but perhaps it was not brought to light because look, men have always had problems.
Yes, yeah.
You know, we always have our issues, but we hold them in.
Yes,
We
yeah.
hold them in
Yes,
because we
yeah.
are what?
Men.
We are men.
True.
Especially the African man, you're not allowed to say.
Yeah, very right,
Emi to be gumma.
Yeah, very right. Very-
Brade gumma.
Very right. Yeah.
Oloza kwa so say tumbafu. Dayo kore.
Yeah, that's right, an observation. But we agree that the trends or the content of the challenges we are having, they can't exceed what you can tolerate.
Yes.
An example now, times are hard. The economy is so tight. We're having these taxes coming in, delays in payments,
Yes,
demands are on the rise. Now, yet now the input is coming down and reducing.
Right.
To some, hopefully now to cope with it, a lot can cook for time till when
You can't
that
take it
bus
anymore.
now comes.
It
through-
manifests itself.
Exactly. Now, your coping mechanisms can be over challenged. Okay?
So everybody copes differently.
Exactly.
course.
There are some who keep quiet, there are some who shout.
And there's no one size fits all.
It varies a lot. It varies a lot. So now for those, if other causes have been, let me say, ruled out, we can say perhaps they were undergoing some situations internally. Their coping mechanisms are now depleted and now over challenged. Now the physical body says enough is enough.
Oguyiwe.
Game over.
Game over.
Yes, sir.
So Marcus,
Yes.
do you remember in 20, of course you remember, in 2019, 2020, did we have? COVID-19.
Yeah, that
I
pandemic.
read a report, I saw things on television that people's mental state and the effects of COVID-19, leave alone the physical,
Will be felt way
but the
longer.
mental aspect will be felt later. Is that part of it? Because people lost businesses, people lost so much,
yeah.
family,
Dear
loved
ones,
ones.
yes, yeah.
You
Jobs
know,
and everything.
and
yeah.
then now it's manifesting itself. Could that be part of it?
We can say it can partly contribute or contributed, plus now the new challenging times indeed we are. We see that reports from the World Bank and the Bank of Uganda, things are a bit up and down. Okay? Now, the moment, or now it sums up to this human body, the brain, which is now the carrier of all that stress, okay? If not helped by seeking for any help, maybe from a friend, or maybe borrowing from somewhere, challenges in the homes, families are broken up, okay? Work issues and everything. In most cases, the body breaks down, including the mind, and then now issues come in, like suicide.
What do you think the role of social media is? Has it made it worse, better? Because some people think the social media is a coping mechanism. I got social media because social media normally has more fun things
Yes.
than they do misery. So I hide in social media.
Yes.
I go and drown my things there. But the problem with that, I was told, I don't know if it's true, that's why I'm asking you, is that when you drown yourself in this social media facade, when you put down your phone,
Marcus using big words.
Yeah, facade.
when you put down your phone and get out of the social media dream, the real world is waiting for you. The Mabanja are still there. The angry wife / girlfriend, whatever, is angrier. The children are still waiting.
Yeah, true.
All the other things that you thought you had run away from
Yeah, rent,
are waiting
loans,
for you.
yeah.
Then you're like, put rug, sweep under, go back. Go back into this dream world.
True.
They are
Exactly,
not
yes.
going anywhere.
Yes, yeah.
If anything,
If anything, it's now 2 months, 3 months, 4 months,
1 year.
1 year. Kati enyumba bagala gitwala.
Robert Omutunzi.
Tolaba.
Yes, yeah.
So I don't know if social media has a role to play and how big is it.
Yes, yeah.
Because like, you see, the thing is this, guy, you and I have been fortunate enough to live in a world where there was no social media. There are people who, 80% of this country don't know that statement, what it means.
Marcus is very old.
Yeah. we have lived. In our times when there was no social media, I think these problems were still there. Men still suffered these same challenges.
True, yeah.
But the outlets and the communication.
The communication, yeah. The spread.
But it seems to be more prevalent now. The so-called pressure is too much on men, but the responsibilities of men are the same.
Have remained, yeah.
They're the same. It's not like people are having 4 children, then now you're having 50. No, it's the reverse. People are having 10 children, then now you're having 1. So how is it that you have more stress than a guy who had 10 kids back in the day? Where is this extra pressure coming from?
Yeah, right, yeah.
Doctor, these are many questions.
Yes, sir.
I mean, we can only do so much as men. Women talk. But now women can talk.
Yes, yeah. Go chat. Go chat.
Yeah, but, yeah, for them, they don't know how to keep it in.
Salon, friends. Yeah, yes.
I'm not going to come to you, Dr. Peter.
Yes, please.
No. ABCD. No, I want to really hold it and try to figure it out.
Yeah.
But like we said,
That's probably the biggest problem, I think.
So is this a problem that's it's getting worse? But what's the way forward? How do we deal with it? Do we go to hospitals? Do we speak more to our friends?
Okay.
What is the way forward?
Okay. Yeah, that's a very good topic and matter you have brought up across. Concerning I'll discuss it under endurance.
Yes.
Endurance. Man, the human being called man, has to undergo two types of endurances, the physical and the mental. It all comes from some bit of science in terms of our brain capacity, okay? The lady's endurance and the man's endurance, okay? A lady, the endurance of a lady.
5 minutes.
Yeah, two even.
Even 30 seconds.
Okay,
With the
now the mental endurance. We are made to tolerate or to carry upon a little degree of what? Endurance as compared to the ladies. Okay? That's a natural fact. It comes from the physiology, the brain cells and everything. Okay? A lady can undertake over more than, let me say, 2 tasks at a go. But for us, it's always one at a time.
One at a time.
And what takes precedence, takes it all, which pays for that time and everything. But the ladies can share their brain fractions to underdo that. Now, the point, what the message we are carrying across is, the moment you see that your endurance is really decreasing, okay, don't count on your manhood that now I can tolerate this. Seek for help from your dad, your uncle, your friends.
But they will laugh at me.
No, yes.
I'm not going to.
Yes.
Marcus will laugh at me.
No, for sure.
Let
laugh at
Marcus-
us.
Marcus is going to laugh at me.
Let Marcus laugh, but when now a life is saved. But now, other than let me say, Marcus coming around at what? At your funeral when you're gone. You get it? Let him laugh. A solution is drawn, and then now life goes on. Other than maybe now things like let me say pressure is coming, hypertension comes in, okay, stress, heart diseases, okay, strokes, all that, because you have a matter, you are sitting on it 1 month, 1 year, okay, 2 years, carrying it on. Heart changes coming, brain changes coming, then now disease manifest. Then now, once in a while, sudden death. So always begin with sharing out what you think is really getting beyond.
A problem shared is a problem solved.
Exactly. Other than sitting on it, carrying it on for years and years, not disclosing it, that's the issue now coming.
But for many men who have been dealing with these responsibilities, where you are saying that the endurance is going lower,
Yes.
I might not know that my endurance is growing lower.
Perfect.
You know, I might just be thinking that this stress is because of child number 2. Or this stress is because they found me with a girlfriend. So the wife is now very angry at home all the time. Therefore, home is not a peaceful place. That's where this extra stress is coming from. But kumbe, like you are saying, the endurance might be going lower.
Exactly.
So at what point must a man know now it's time to seek help?
Very good. So when that happens, your presentation, you may not be conscious of it, but something changes.
Yes.
Okay? We have the changes in sleep. Okay? We have sleepless nights or oversleep. Your appetite, it might go low. Okay?
Or too high.
Less common does it go too high. Okay? Your activities of interest, let me say watching the Premier League, nowadays they see you maybe in your car or in a park alone. Okay? You used to be with him, but nowadays, 2 weeks now, he isn't seeing you. Such changes will now prompt him to say, what about Marcus? Go out for a meal, no longer feeds as it used to be. Okay? A drink, cut off. At night, 3 a.m. is calling you, not sleeping. You get it? Then also now, the manpower, the manhood. Okay? It has to misbehave. Now, when now you get such changes in your life, in your being, okay, there are evident warning signs that something is cooking. Okay? Share with Gaetano, share with a doctor, a psychologist, and then now we have you helped out. And the good thing, we have now all those specialties in our facility. Okay? A psychologist is around, psychiatrist is around, a counselor, yes, is around. Okay? We have a team always available ready to talk to you through the problem you're having before you come into the worst state of the disease.
Yes.
One time I remember somewhere, someone approached me, a 25-year-old. Okay? He was, I think, an IT specialist. But his work is so tight, dealing with deadlines. Okay? This report. Now, his issue was he wasn't longer performing in bed. 25 years.
Horizontal entertainment was not there.
Exactly.
And he's 25.
25 years. which we think is a disease of what? Of 60 years and
And
above.
25 years supposed to be at your
At your prime.
You get it. You get it. Listening to his story, the issue was, he sleeps at 1 a.m. after his reports, night reports. Wakes up at 5 a.m.
to go back to work.
Go to work, meet deadlines.
When does he have time to?
Of course. Now, which means now you sleep with your mind, think of reports.
So you don't even really sleep. You don't rest, yeah.
Now with that, the mind now diverted, you can't perform. It becomes hard.
Marcus, have you been able to perform?
So anyway,
The doctor just told us
Yes.
to talk.
Yes, yeah, you share.
Marcus,
yeah. You tell me the day you failed to perform. I forgot that's talking.
please, this is not about
Doctor did
me.
not say ask questions.
It's not about me, Marcus. It's about you. Tell us, Marcus. Please pay attention. What is your problem, Marcus? Do you have? That's what you mean? Like this?
Not now. Not now. Somewhere.
Somewhere else.
Somewhere. Yeah, somewhere
Yeah.
else.
And I think when that sexual conversation comes into
Yes,
play,
yeah.
for most men,
Yes.
that's a complete death
Exactly.
sentence.
Exactly. Yeah.
Like, what is a man if you're not able to perform?
And it is on the rise. People in silence. Okay, with it. Yet it has very detrimental worries to the man, to the couple, and the family. But once now you come out, okay, share with the doctor, okay, a friend, okay. You could be going through the same situation. Then now you share with a solution that can help both of you, okay, other than keeping down with it. Yes, yeah.
What is the difference between a psychiatrist, a psychologist, and a counselor?
A counselor. Very, very good question.
It's
Yeah.
spelled differently.
Besides that obvious difference to above.
Okay. Yeah, very good question. For clarification, yeah. A psychiatrist is a medical doctor.
Psychiatrist.
Yes, yeah, a medical doctor who has gone further to specialize, okay, into treating, okay, into medical management and other modalities of treating mental illness or
Okay.
illnesses,
Okay.
which have a wide array or a wide scope.
That is psychiatrist.
Psychiatrist, okay, medical doctor. However, we have others who train in the same practice, but not as medical doctors. The medical clinical psychiatrists, okay, or the psychiatric clinical officers. Now, the psychologist is a professional who has trained in social skills, okay, in helping out someone, not using
Medicine.
medicines. Talking
Who's
to
a psycho?
exactly your mind, the mind. Yeah, he talks to you to know your problem, how you can cope with it.
Right.
Okay, depression. Okay, mourning and everything, sadness, work issues, and all that. That's a psychologist.
Without prescription.
Exactly, yeah. Then now, if now he or she sees that, needs some medical management of that condition,
They send you to
he now
psychiatrist.
refers you to the psychiatrist to get some medicines.
Counselor?
A counselor is also under the
psychologist.
The psychologist. They end up doing the same kind of work, okay, but the training is different for both of them.
But both of them cannot prescribe.
They can
The
prescribe.
day they realize that this problem requires medicine,
Exactly.
we
They
send
refer
you to the boss.
Exactly, yeah.
The main guy is psychiatrist. Okay, I've always wanted to know. So based on how you see somebody, you will then determine this one needs a psychiatrist,
Exactly.
this one needs just a counselor,
Exactly.
this one needs a psychologist.
And the practice is so good. Even a psychiatrist, I have a supreme there, okay? They end up getting the services of what? Of the counselor and the psychologist, yeah, to get the services. Because now they can't do all, though they have a hint. But these guys also have areas where they are the bosses in managing that.
Managing.
Yeah, like
Is
psychotherapists and
it,
everything.
yeah, is it, I mean, you talk of these areas. Now, if I go to Case Hospital
Yes, please.
and I want to see one of, I'm still confused.
Of the above, yeah.
One of-
Psychiatrist,
one of
psychologist,
those-
yeah. And the counselor, yes, yeah.
I'll write for your WhatsApp. I know
Yeah, right.
these things are too fast for you sometimes. I'll write for your WhatsApp and I send it to you. I'll give it to you like for a P2A kid. I'll send it to you.
If
yes.
I'm to go and have a conversation
Yes, yeah.
with one of the above,
Okay.
obviously it's confidential.
Of course, certainly it is, yeah.
You know, doctor,
It is, yeah.
Client.
Patient relationship, yeah.
relationship, you know, and all of that.
Always observe,
Yes.
yeah.
I would like to think that as a family man,
Yes.
and you have a problem, is it wise to bring in your partner at a particular stage of the conversation? Maybe not at the beginning, or maybe at the beginning, or maybe later. Would it be wise to bring in, somebody, your partner to...
And what does the African setting of you bringing in your wife mean? Because you can imagine Ugandan women.
It was... No, that man is wise. That man is wise.
But you know how some African women
Yes,
can
of
be.
course.
Yes.
Of course, yeah. In that regard, basing on what the concern is, the matter is, okay? At first presentation, the psychiatrist or the psychologist or the counselor will give you ample time as they do at Case Hospital, okay? I think I talk less around 1 hour and a half and beyond, minimum, okay? It's really a good time they give you for you to be listened to get some help. Now, it will depend on what he or she has realized from the discussion with him, okay? If it's concerning family, we have family therapy, okay? Or couple therapy, okay? Whereby now, the spouse has to be present. So in view of what you present with, he or she will judge what the partner will come into play. Then also in the point of the solution, some solutions can also come from when your partner is available to assist you in working through that matter. So when there is need, a partner also plays a very, very big role in that care or plan. Yes, yeah. It is very, very important. Yeah. Very important. Yeah. Very important. Then also at times, in the discussion, the cause maybe of the matter can be your partner. Okay?
Yeah.
When he or she is talked to, it can solve the problem at once.
there.
Yeah.
Okay, I think I will bring Marcus over to Case Hospital.
Okay, please, yeah. Welcome. 24 hours a day,
24 hours, Marcus.
7 days a week.
When you're ready, I'll take
Yeah,
you there.
in, yeah, out, yeah. Please, yeah.
Your issues.
And finally, the mental conversation
Yes, please.
does not necessarily lead to the sexual help. And the reverse is true. They could be independently causing your own mental problems.
Exactly. However, both they interact.
They interact.
They can cause the other one to become unwell. They share. If, let me say, you have issues with your power in the bedroom, it will stress the man.
The child, you can see, doctor.
Exactly.
The child is not happy.
And it becomes stressful.
Okay. Even now, your friend, the partner, will complain. You will be sad. Now, that sadness will keep on accumulating. The more now you worry about it, the more even the chap down there also becomes sad.
Yeah.
You get it? So it's a cycle and interaction, yeah.
And that completely affects mental
Exactly.
thereafter.
Exactly, yeah.
Now, normally, unless you had something else, I was gonna.
No. I mean, I wanted doctor to just speak to men now in summary. Just say, guys, you are not the only ones. Just come and we talk.
Okay.
Which one is best? This one or that one?
That one.
That one. Okay. Tell the men. Tell the men in 30 seconds.
Thank you so
Tell
much.
the
Yeah.
men.
Thank you so much. Yeah. Guys out there,
Yeah, this one.
Men.
This one. Look at the camera.
men of any age, right from adolescents, okay, adulthood, middle age, and elderly, any matter or concern you have, okay, once you feel unwell in any of your physical well-being, okay, social being and mental being, which is very, very, very wide, okay, please don't die in silence or keep quiet with the problem. Come to our facility, Case Hospital. We are available to offer a wide array of services to help you out before the worst comes to its implementation. Yeah. Always most welcome. All right. Thank you so much.
Thank you.
Okay. All right.
Talk to me.
It goes to you.
I'm here for you guys.
Cheers.
I'm here.
Doctor,
Come. Sometimes I won't even say anything. I'll just give you a hug.
Please. Always
I'll give you
welcome.
a number. He'll
Please,
call
yeah.
you.
Please.
No, thank you so much. Thank you, doctor.
Okay, guys.